In this video, I'll go through the exercises that I use in what we call the intermediate post-op phase after a total shoulder replacement. Hi everybody, welcome back to the channel. So intermediate post-op phase after an anatomical, or sometimes called conventional, total shoulder replacement. So this phase begins about 4 to 6 weeks after surgery and lasts approximately 4 to 6 weeks. Now, how is this stage different than our prior stage? Number one, we can do a lot more with shoulder range of motion. We really start getting going with our shoulder range of motion in this stage. We start some rotator cuff muscle strengthening, and we progress arm and shoulder blade muscle strengthening as well. Now, you might remember from our first phase video that there are a bunch of movement restrictions that are really very strict in our first phase. Some of those movement restrictions go away because enough healing has occurred that the shoulder can take a little bit of movement stress. But some of those restrictions continue, and I'll go through those at the end of the video. I mentioned in the intro that in this intermediate post-op phase, we can finally start moving the shoulder. So here's one exercise for that. Simply take a broom handle. My hurt side in this example is my left side, and I'm simply going to push with my opposite arm through the handle, pushing the hurt arm up until I feel a little stretch. Hold for just a moment, come down kind of slow. Up and down 10 to 15 times. Now, if that's easy for you, you can get a little fancy, push the arm up, try to hold it there for a moment, take the stick away, lower down on the arm's own power. Reach up with the assistance of the stick, lower down without the assistance of the stick. Now, once you can do that, you can simply get rid of the stick as an assist and simply reach up and down. Now, one key here, never reach into a shrug. Don't do this just to get the arm way up in the air. If you're doing this, it means you still need the stick. Reach up, no shrug, hold for a moment, lower down in a controlled manner. The point of this exercise is to improve external rotation of the shoulder. Now, we have to be cautious with this one because if we overdo this movement, we can apply too much stress to some of the healing tissue in the shoulder that had to be cut through to get the new parts in. So keep this one gentle. So sitting with your arm propped up on a pillow, use some kind of stick, broom handle works great, and simply push the hurt side out a bit, but only about that far. So that's about a 30-degree external rotation angle at my shoulder, my hand out this far. So here would be our 0 position. Here's about our 30-degree position. We don't want to go any further than that. Back to center. Push out to that 30-degree position. Hold about 10 seconds. Come back. Go back and forth 10 times. Again, I can't stress enough, don't go much farther than this position. Again, approximately 30 degrees of external rotation. Next, we're going to start gently strengthening the rotator cuff. So you'll need a stationary object. I'm going to use my chair with some weight in it to kind of stabilize it. You can use a heavier piece of furniture, a door frame, a corner, anything solid, okay? So with my elbow bent 90 degrees, I'm simply going to push the back of my hand into the chair. Push, hold, 5 seconds, relax. Do this about 10 to 15 times. Now keep the pressure pretty light. There should be no pain reproduced with this, okay? Push and hold, 5 seconds, relax. So again, 10 to 15 reps in this position, then straighten the elbow. Now I'm pushing my hand again into the chair as if I'm trying to do this, but the chair is blocking me. Push, hold, again, 5 seconds, relax. Keep pressure pretty gentle at this point. Push, hold, 10 to 15 repetitions. The point of this exercise is to improve overhead reaching. So, lying on your back, you're going to need some kind of stick. And the point of this is so the unhurt side can help the hurt side, okay? So I've got my stick, golf club, broom handle. My hands are only about a foot or so apart, okay? And again, that's so the unhurt side can help the hurt side. And simply reach up overhead. Now, the point of being on the back is so gravity can help toward the end of the movement, right? Gravity is kind of pulling me into greater reaching. Hold for just a moment or two, come back to the starting point. Reach up, feel some stretch, hold for a moment or two, come back to the starting point. Up and down 15 to 20 times. For our last exercise, we're going to start to strengthen those shoulder blade muscles. So we'll need some elastic band, keep it pretty light, secured on something solid. Starting in about this position, right? There's already a little bit of tension in that band. It's kind of holding my arm out if my arm is just relaxed. I'm up tall. You got to stay up tall during the entire exercise. Keep the shoulder blades down and in. Pull to the hip, no farther. Hold for a moment. Back to the starting point. pull to the hip, hold, back to the starting point. So notice, again, very important, I'm not pulling past my hip. This applies too much stress to the repair, so you can't go this far. That's important. Back to the starting point again, pull to the hip, hold, 10 to 15 repetitions. I mentioned in the intro that at this phase of rehab, we graduate past some of our initial post-operative movement restrictions, but some continue. So here's the deal on movement restrictions in this intermediate post-op phase. So sling use, number one. So pretty much during waking hours, we can get rid of the sling. There are some exceptions to that, so work with your therapist on what might be best for you, but for the most part, when you're moving around the house, ditch the sling. You still have to use the sling, however, when you're sleeping, and that's to prevent you from kind of flopping into an awkward position of the shoulder while you're sleeping. So sling use when you're sleeping, no sling use when you're awake. So some things you can't do. You can't reach this way. We call this external rotation of the shoulder. We can't go past about 30 degrees. That's about that position, okay? So for example, slipping your arm into a coat sleeve might get you into a bit of a touchy position. So be careful with reaching this way far, okay? You can't bear weight through the arm yet. So leaning on a countertop, for example, can't do that on the hurt arm. You can't lift anything of any real weight. So for example, you can lift and carry a cup of coffee or something of that equivalent weight, but that's about it. And lastly, no sudden movements of the shoulder. Those are the exercises I like to use with my patients who are in that intermediate post-op phase after a conventional total shoulder replacement. So again, this starts somewhere around 4 to 6 weeks after surgery and lasts about 4 to 6 weeks. I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, again, leave a comment, and we'll see you in the next video.